Hi, I'm Dr. Aidoo of the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. We want to look at the pelvic girdle, and we want to just appreciate the difference between the male and then the female. So let's begin by looking at the major bone that form the pelvic girdle. Remember, there's also another girdle called the pectoral girdle, which is more of the shoulder region. So this is the pelvic region. So you have three major bones, right? You have the ilium, you have the pubis, and then the ischium. So we take each of them one after the other and look at the parts. So we begin with the ilium. The ilium has the iliac crest, and then you have this fossa known as the iliac fossa, and then this flat portion known as the ala, okay, or the wing. Then when we come to this portion, the pubis, we have the pubic symphysis, and then you have the superior pubic ramus, and then the inferior pubic ramus. Then that is the obturator foramen. All right. For the ilium too, you can look at this portion that protrude forwards or anteriorly, known as the anterior superior iliac spine, and then this is the anterior inferior iliac spine. Then you can have this portion of the ischium, so that is the ischial spine, and then the ischial tuberosity. Okay, so again, you have the ischial spine here and ischial tuberosity. Then you have this notch here, that is the greater sciatic notch, and then a smaller one known as the lesser sciatic notch. Now, the major difference between the male and female pelvic girdle is the fact that for the male, the anterior posterior or the conjugate measurement is more related anterior posteriorly compared to that of the female, which is more transverse, okay, or oval. All right. Then also for the males, they have a taller or deeper pubic symphysis. So you are looking at this portion. So for the female, it will be shorter. So this region where you have the conjugate from the pubic symphysis here to the sacral promontory, that becomes the pelvic inlet. Okay, it's a pelvic inlet measurement. And you can also have a pelvic outlet measurement. So you look at the inferior portion of the pubic symphysis, and then you measure it towards the tip of the coccyx. Okay, so it will be from that point to that point. So I can use this to indicate that. So that will be the pelvic outlet measurement, and then this will be pelvic inlet measurement. All right. So for the purpose of labor and parturition in women, they tend to have a wider pelvic girdle. So the wing or ala is wide and more apart. Okay. Then also their ischial tuberosity is also wider apart compared to that of the male. So this is basically a short review of the pelvic girdle. I hope this video helps. Thank you very much. Hello, I'm Dr. Aidoo of the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. My friend here is going to help us to appreciate the thoracic cavity and the thoracic cage. So this is the thoracic region and the cage. So the cage really looks like a cage, like that of a bird or any other domestic animal we keep at home, because it is hollow, okay, and it has something like a fence. Okay, so this hollow nature will accommodate soft tissues like the heart, which will occupy the left side here, and you have the lungs, which will occupy both sides. You also have the diaphragm, covering this portion, and you also have portions of the liver, okay, there. The rib cage also have some muscles known as intercostal muscles that fill up and help protect the soft tissues inside. Because of this, if anybody wants to stab somebody to death, the person has to know the anatomy of the rib cage in order to penetrate, else the knife will hit an object that is in the form of the rib. Okay, so it cannot penetrate. So usually if you watch movies, people who stab people to death are very skillful by going through these spaces to target the heart most of the time. The ribs are made up of bony portions and then cartilaginous portion. The cartilage type here is known as the hyaline cartilage. There are three main types of cartilages. You have the hyaline cartilage, fibrocartilage, and the elastic cartilage. You have the hyaline cartilage here, and these are the bony portions. There are 12 ribs on both sides, and both male and female have equal ribs. Okay, there's this school of thought, or people think that because the Bible says God took one rib of Adam and created Eve, men have one less rib. That is quite interesting. If that is the case, then how many ribs will Eve have? Well, you can guess. But the truth of the matter is that both male and female have 12 ribs each. We are going to count them. So you have 1 there, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you have 11 and 12 there. So the same thing here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 and 12. Now the ribs can be divided into true ribs and false ribs. The true ribs are those that have their cartilages attached to this middle portion of the bone known as the sternum. So the first 7 ribs have their connection directly to the sternum, so they are called true ribs. Then the 8th, 9th and 10th have their cartilages joining that of the 7. So 1, 2, 3, 4, 5, 6, 7 will be true. Then 8, 9, 10 joins that of the 7 and then goes all the way up. Because of that, it is a false rib. Then you also have the floating ribs, which are these ones. They are not having any cartilage attached to the sternum, so they are free and known as the floating ribs. Now this region is also important. The sternum is made up of the manubrium, the body, and then the xiphoid process. Alright, so if a man usually hits his chest to show his manliness, it is this bone that he's hitting. It doesn't mean women don't have. Women also have this. Now, it is of clinical importance to note this region where the manubrium joins that of the body of the sternum, known as the manubriosternal angle or manubriosternal joint, or the angle of Lewis. So clinicians use this to actually give an indication of the bifurcation of the trachea and also how the aorta arches, okay, among others. So it is of clinical importance. We also have to appreciate the fact that the ribs go posteriorly and attach to the vertebra. Okay, so it is closed at this portion. Now the ribs help protect the soft tissues like the heart, the lungs, the liver and other structures. Then it also helps in breathing, because once you breathe in and out, the ribs expand, okay, and they increase the volume of the thoracic cage depending on whether the muscles are contracting or relaxing. So there are muscles that are attached all over, known as the intercostal muscles. So this is a short review of the thoracic cage, and I hope this video helps. It is also important to note before I leave that the manubriosternal angle also helps clinicians to count the ribs, because oftentimes this clavicle obstructs the first rib. So usually it's difficult to locate and count it. So once they know that the manubriosternal angle or the angle of Lewis is connected to the second rib, they can just count 2, 3 and then on they go. Thank you very much, and I hope this video helps.